Methotrexate. For some, it's been life-changing, and for others, it's a dirty word. A tried and true staple in rheumatology clinics, whether you have lupus, RA, or psoriatic arthritis, chances are methotrexate has come up in your appointments. That doesn't mean it's a good fit for everyone, and I have seen a number of people put up with crazy side effects not knowing they had other options or they could even speak up. So today, I want to go over the common and not so common side effects of methotrexate, how to manage them, and when to call it quits and move on to something else. I'm Dr. Elizabeth Ortiz, and this is Connected Rheumatology. Let's get started. Methotrexate is considered a chemotherapy that has been used in autoimmune conditions since the 60s. Dermatologists were actually the first to use it in psoriasis, but then rheumatology quickly adopted it, and we now use it for almost every autoimmune disease, particularly when joint pain or arthritis is the predominant feature. The side effects of methotrexate are generally dose-dependent, meaning the higher doses increase the likelihood of experiencing side effects. This is a good thing for rheumatology because typically we use low-dose methotrexate, which results in fewer and less severe side effects compared to those experienced by cancer patients. So for context, low doses range from 7.5 to 25 milligrams per week, while some cancer patients may receive injections of over 1,000 milligrams. That being said, it is still true that most people on methotrexate, even at low doses, will experience some side effects at some point. But in the case of methotrexate, context is everything when deciding how to manage the side effects. And by that I mean how we react to side effects depends on what we're treating, how severe the autoimmune condition is, and how serious or life-interrupting the side effect is. So let's start with one of the most common side effects, and that is stomach upset, particularly nausea. While diarrhea and vomiting can occur, they are less likely, but that doesn't mean that the nausea can't make you miserable. If it happens, the nausea from methotrexate typically starts 24 to 48 hours after taking your dose. Some people may even develop anticipatory nausea, which just means they start to feel nauseous even before their methotrexate dose. To manage the nausea, you can take acid reducers, an H2 blocker, or a PPI around the time of your dose. Sometimes we may split the dose. So for example, if you take 20 milligrams once a week, which is 8 tablets of 2.5 milligrams, we may have you take 4 tablets or 10 milligrams on 2 consecutive days. Increasing your folic acid intake can also help. As I've mentioned in another methotrexate video, methotrexate is involved in folic acid metabolism. So supplementing with folic acid can prevent a lot of these side effects. While the standard folic acid prescription is 1 milligram per day, we may increase it to 5 milligrams daily if you're having nausea or stomach problems. If the nausea becomes unbearable, even if the methotrexate is helping your condition, we can't lose sight of your overall quality of life. While we aim to reduce the inflammation and protect your joints and body for tomorrow, we also want you to feel better today. Thankfully, we are now in a world where we have other options for autoimmune disease, so we don't have to suffer through miserable side effects. Next, we have stomatitis, or oral mucositis, or mouth irritation and sores. This is a side effect that is typically very sensitive to folic acid dosing. So if you're experiencing this on 1 milligram of daily folic acid, ask your doctor about if and how you can increase your folic acid dose. Typically, we will recommend increasing the dose 1 milligram at a time every few weeks until we find the dose that takes care of that mouth irritation. If folic acid isn't cutting it, we may also add a second medication, leucovorin, which is another metabolite of folic acid. If you have raised your folic acid, started leucovorin, and are still having trouble, then again, we aren't trying to make you miserable. Let your doctor know and see if you need to decrease your dose or even stop it. I've prescribed methotrexate a lot, as most rheumatologists have, and I've never had to stop it for this reason, but it's certainly something that can happen, so make sure to bring it up with your doctor if you're having issues. Drug rashes are often something listed as a potential side effect for most medications, and although it can happen with methotrexate, it's not common. I can probably count on one hand how many times I've seen it happen, but that doesn't mean it's impossible. And although I would advise, just like any other side effect, to keep track of how severe and bothersome the rash is, I would pay extra attention to any rash, as it may be a sign of a true methotrexate allergy, in which case you want to stop the medication altogether. Now, let's talk about potential effects on our nervous system. This one is tough because symptoms of this side effect can be brain fog, headache, and fatigue, 3 things that are very common for most autoimmune conditions. So it can be challenging to know, is this my disease or is this the methotrexate? This is why knowing your disease and symptoms and paying close attention to how you feel before and after any intervention makes a big difference. And I'm using that word intervention on purpose because I think there are many things that can be considered an intervention aimed at helping us feel better, right? Medications are certainly interventions, as are surgeries, but so is starting a new gym or starting a new diet. Anything you do to improve your health can be considered an intervention, and knowing how you feel before and after can help you gauge if that intervention is helping or not. So next we have methotrexate's effects on our cell counts. Now, we can see our cell counts from our CBC, or the complete blood count test we get each time we see our rheumatologist. And it tells us about our white blood cells, our red blood cells, and our platelets. Most chemotherapies, including methotrexate, can lower our cell counts. The good news is that because we use low doses in rheumatology, this is not common. But it is one of the reasons we need regular blood tests done when you're on methotrexate. It's standard to get your blood tested every 2 to 3 months while on methotrexate, and your doctor may even withhold your next refill if you haven't gotten your test done. This may seem extreme, but if your cell counts or your liver numbers, which I'm going to get into in a sec, are off, and you keep taking methotrexate without any adjustments, you could end up in some real trouble. So regular blood tests are our way of preventing that. Aside from cell counts, the other big effect we are testing in your blood work is liver inflammation. I know liver inflammation can sound super scary, but honestly, it's reasonably common. Most of the time, this isn't something you feel, but something we catch in your blood test, specifically by looking at 2 enzymes that come from the liver, the AST and the ALT. Having elevated AST or ALT can be an indication of liver inflammation, and catching them high at some point or another is very common for those taking methotrexate. When this happens, depending on how high they are, we may just watch it, we may lower the methotrexate dose, or we may stop it altogether. Thankfully, in rheumatology, at the dose of methotrexate that we use, we typically don't see liver emergencies or failure that can be seen in those that take it at much higher doses. But it is because of this risk that we typically recommend holding or significantly lowering your alcohol intake. Because think about it, methotrexate is an irritant to the liver, just like alcohol. So when we are on methotrexate, we want to limit our liver's exposure to other irritants, so we have to cool it on the drinking. And another irritant is fat. Having a fatty liver, which is becoming more and more common, is another risk. So we have to be even doubly more careful when adding methotrexate in this situation. A side effect we have learned is more common than we previously thought is methotrexate effect on the lungs. This by no means affects everyone. But in the last 10 to 15 years, we have learned it's not as rare as we once thought, and for this reason, you will often be advised to get a lung x-ray before starting methotrexate. This is done to serve as a baseline. So if you were to start feeling winded, short of breath, or develop a persistent cough, a new lung x-ray can be compared to your baseline. And although not technically a side effect, we have to mention infection as something to look out for when taking methotrexate. Because remember, methotrexate is a chemotherapy, so it does lower or suppress your immune system, regardless of whether or not your white blood cell count changes in your blood test. But the good news is this is dose dependent and not nearly as big of a problem in rheumatology as it is for those taking it for cancer. In RA and most of my other autoimmune conditions, the risk for infection is usually not tied to just one medication, but instead the collection of medications someone may be taking combined with their condition. Meaning that having a lot of inflammation and very active autoimmune disease in and of itself puts people at risk for infection. This combined with, say, prednisone and a few other immune system targeted meds come together and synergize to form the perfect storm, making the system vulnerable to infections. Thankfully, just being on methotrexate alone or even in combination with hydroxychloroquine doesn't significantly increase your risk of severe infections. When should you think about stopping methotrexate? Well, like I said, unless you are facing a dire, life-threatening situation, we usually have options, and you don't need to suffer through a treatment that is making you miserable. But there are some factors that should go into your decision to stop. Here are some questions I recommend asking yourself and discussing with your doctor. How burdensome or dangerous are the side effects that you're experiencing? Have you tried a higher folic acid dose? Would changing from oral pills to methotrexate injections solve the problem? Have you had to add a number of other medications just to deal with the side effects? And are there reasonable alternatives for your condition? Despite this list of potential side effects, there's just no getting around the fact that methotrexate can be incredibly effective and your rheumatologist is very comfortable and knowledgeable about it. But that doesn't mean you shouldn't get to have a say and that you shouldn't understand what you should look out for. If you want to learn more about why and how we use methotrexate, I recommend watching this video next. And if you want access to that new medication worksheet, live events with me, and an awesome private community of others on the same journey as you, I'd recommend checking out the Connected Clubhouse. That link is in the description box. As always, thanks for watching, and I'll see you next time.